Cool. We will get started with this one. So this section on digestive system, anatomy, and physiology is an interesting one just because there's so many different organs and structures that are involved, and everything has its own different role. But then also most of the things that we're talking about also have other roles too outside of the GI system, outside of the digestive system process, right? So we're going to focus this, I'll touch on a little bit of it, but we'll focus on just like the liver, for example, is what's the liver's function in digestion, right? It does some other things too, and we should study those other things. But for a starting point, just when we're talking about the digestive system, right, sometimes it's easier to just talk about everything for how it works on that process. And then we can talk about, you know, the other things that these things do for those other processes. So this one, we're just going to talk about the digestive system and really what it does, how it does it, and, you know, a little bit of kind of some of the patient assessment stuff that's going to come with it. Right? So on this one, cool. The digestive system and, again, kind of all of those structures and everything have 6 real kind of core functions overall as a system, right? Every organ and structure within that system has its own kind of involvement, right? But everything kind of pulls back to these 6 primary processes. So the first one is ingestion, right? Ingestion is just how do we actually get, you know, we're just going to keep saying food, right? For the sake of, you know, the description, right? How do we get the food to enter into the GI system, right? So it's literally, it's mechanically, it's actually picking up food and putting it in our mouth, right? Not the chewing it up, that's one of the next processes, right? But it's actually just getting the food to enter into the GI system. And the second one is now we actually have to process that food mechanically, right? And that's just a fancy way of saying we have to break down that food from big things that we eat to smaller little chunks that we're actually going to be able to move through our GI system. Or an even easier way of saying that is chewing, right? We're going to chew the food, right? So mechanical processing is chewing, or that fancy word for chewing, mastication, right? Is kind of chomping up on all that food to take, you know, the big burger that we ate and to break it down into just the kind of substance, right? Just the stuff that we're going to send down to our stomach. And then the third part is digestion, and we're going to actually get into, you know, a little bit more of the definitions of these and which structures kind of come into play with them. But digestion is kind of chemically breaking down that food, right? So we eat, you know, big proteins, we have to break them down to the small little amino acids that our body's actually going to be able to use. Or big carbohydrates, we have to break down to simple sugars, right? Big fats down to little fatty acids, right? So we have to be able to continue to break down beyond just chewing everything up. Now we have to be able to break it down to a truly kind of micronutrient level that our body is actually going to be able to absorb, right? And then be able to kind of distribute throughout the body so we can use it for energy production. Fourth one is secretion, right? So whether it's saliva that we're talking about, or the acids in the stomach, or the enzymes from the pancreas, right? Is the chemicals that actually get released by some of these structures to help with digestion, right? So we said we're chemically breaking down the food in digestion. Well, we're chemically breaking it down with the enzymes and acids and things that these structures are secreting, right? So this digestion and secretion really go kind of hand in hand together. And then fifth is absorption, right? So just like we said, we have to be able to then, once everything's down to that true kind of micronutrient level, because then it has to actually be absorbed into the body, right? Into the fluid, into the interstitial fluid, and then ultimately, you know, into the bloodstream, into the tissues, into the structures. And then the last one is then the elimination, the excretion, right? So whatever it is that we eat, not 100% of it goes into our cells and tissues and structures, right? Some of that obviously ends up, in a bowel movement, right? So we have to excrete anything else that didn't end up getting used during that process. All right, so those are the 6 primary processes. Again, we're going to work through them individually, and then we're going to work through the organs and structures that are involved in that. And then finally, we're going to kind of put it all together contextual with, we eat this food, what happens on its journey through the digestive system. All right, so there's 2 major divisions or 2 broad categories of structures when we talk about the digestive system. So just like we have the nervous system, but we can say we have the central nervous system and the peripheral nervous system, right? We have the digestive system, but we have 2 different kind of component pieces of that. Right? And the first one here is the alimentary canal, right? And that's just a fancy name for saying like, that's the pipe, right? If you ate food and just thought about, okay, here's the foods going down here, through the GI system, through all the intestines, and then, out the rectum in a bowel movement, right? That's the alimentary canal, right? So starts at the mouth, ends with the rectum, right? So we swallow food, it goes down our esophagus, through our stomach, through our small intestines, through our large intestine, and out the rectum, right? That's the alimentary canal, right? Or you think about like a boat going down a canal, right? It's just going to follow the river, right? It's going to follow the path. And the pathway is all the tubes, right? All these pipes, all these esophagus, intestines, and large intestine, and everything that food moves through, right? So that's the alimentary canal. And then the other one is all the other organs that have a role, right? So accessory digestive organs, right? So the liver's function in the digestive system process that we're going to talk about, the pancreas's function in the digestive system, right? So we have the canal and we have the other organs that are really helping with that secretion aspect, right? They're the ones pushing some of those chemicals into the GI system to help break down those food, molecules, food components into the smaller little micronutrients that we can actually absorb. So those are our 2 kind of broad categories. Okay. And so moving through them a little bit more in depth, right, is what we said we started with, which is ingestion. And, kind of, facetiously or silly to a point. So the structures are the hands and mouth, right? You got to take the food, put it in your mouth, right? Hands not officially a structure of the digestive system, but obviously we got to get the food in somehow, right? So it's really the mouth, right? It's just, kind of receiving the food, right? Again, it's not chewing it up and breaking it down. That's really the next step. But ingestion is just the process, a physical process of bringing food and material into the digestive system, into the digestive tract via the mouth, right? So it's putting the burger in your mouth, right? Taking a bite, right? It's getting that food inside. Mechanical process is the next one. That one's actually chewing it up, breaking it down, right? Crushing and breaking. It's as large materials. So that burger, right, back on that one, right? Take that big burger and we got to break it down into little burger bites that we can actually swallow and start to send through the digestive system, right? So breaking big stuff down into smaller stuff so that it can move a little bit more easily, right? We can't swallow that whole big burger, right? We have to swallow the smaller little chunks as we chew it up, right? Or a great analogy or a great saying or phrase that's out there, right? How do you eat an elephant? One bite at a time, right? Or how do you eat a whale? One bite at a time, right? How do you learn anatomy and physiology? One bite at a time, right? You can't take in the entire thing. We've got to chunk it out, right? We got to chip away at it. That's why some of the organs, like I said, that we're going to talk about, like the liver, we're going to talk about its function really just with the digestive system, because we're just going to take this little chunk of anatomy and physiology today, right? As opposed to saying, all right, we're going to talk about GI system, but hey, here's how this actually works on the blood. Here's how this actually works in the endocrine system. Here's how this helps with the immune system, right? We're going to cut out all the extra stuff today, and we're going to say, how's the digestive system work, right? So that we can actually start to take the more massive quantity of anatomy and physiology, put it into a little smaller chunk that we're actually able to consume to help move through, right? Once we feel better with this one, then we'll do another topic on anatomy and physiology, right? The endocrine system, the nervous system, right? Just different components of it. All right, so structures, right? Obviously we have the teeth, we have the tongue, right? We have the muscles of the jaw that are really going to help with that chewing process, right? So teeth, tongue, and again, you could say some of those facial muscles, and then the nerves that control those facial muscles, right? That would be perfectly acceptable to say those are all involved here with our ability to actually chew food, or again, that mechanical process, or that fancy word that I said, mastication, right? Mastication. That's O, mastication. Right? So that is that physical mechanical process of actually chewing up food to break it down into its smaller components. All right, so structures within that one, right? We say we got the teeth, the tongue, right? So the teeth, we don't spend nearly as much time talking about it because at least in paramedicine, the teeth is not usually associated with a big life-threatening emergency. And most of our time and focus and attention goes to things that are much more likely to cause a acutely, emergently life-threatening situation. Obviously, if the teeth break loose and they're occluding the airway, for sure, right? But generally not, too terribly often. But important parts to just kind of remember just structurally, right? We have 32 permanent teeth, right? Typically, most people, 32 permanent teeth, right? Kind of working our way from the outside in, right? The very outer layer is the enamel, right? And then kind of, just below that enamel surface, a little bit deeper in, is what's called the dentin, right? And then we have deep down in the middle, the orange part in this picture, right, is the pulp, which is really tied in with, the root, right? Like if you heard somebody have a root canal, right, that's really kind of deep down in there, right? But that outermost layer, right, is our enamel. And we've heard about that one in brushing our teeth and everything, is we're protecting the enamel, right? Dentin is kind of the next layer down, and then pulp is kind of that core middle layer. Now I put it here because it gets talked about here, but then it never really gets brought up again. But it's really just one of those times in which they use the same word to cover different things than what we're used to. Right? So if I say alveoli, hopefully 100% of us says alveoli are those little sacs in the lungs, right, where the gas exchange happens, right, where the oxygen can get through the alveolar capillary membrane into the bloodstream, and the carbon dioxide can get out of the bloodstream back into the alveoli, so we breathe it out, right? But they do use alveoli, right, in the context of teeth to really be kind of, that socket, right? Where your tooth is actually, kind of resting in your mouth, right? Each tooth has its own little socket, right? Its own little kind of space for that tooth to rest in, right? That socket or that space is called the alveoli, right? And so kind of that open space that's there, just like we have that space sac for the alveoli in our lungs, we have that space sac, so to speak, that tooth, right, just rests in, right? That is the alveoli, right? So it's a word that, again, 99.9% of the time we use it, we talk about the lungs, right? But it is the same word that's used here to talk about that tooth socket, or where your tooth is actually resting into. All right. All right. Tongue, we said, was another piece associated with the physical mechanical processing, the chewing, the mastication, is that tongue also kind of moving around and shaping that food so that we can swallow it, so that it'll fit more easily down our esophagus. Right? And that's where, really, like I said, we can get into, nerve control, right? Because that's a muscle-driven process, and muscles work because they're stimulated by nerves, right? So some of the cranial nerves, right? That's our CN here, is cranial nerves. So cranial nerve XII, right? Remember that one's Roman numeral 12, right? IX is Roman numeral 9, V is 5, and VII is 7, right? So some of the different facial nerves, right, or cranial nerves rather, one of them is the facial nerve, some of the different cranial nerves that go and actually help us control our jaw muscles, our face muscles, right, our tongue, right, and we see it in here, right, we see words like glossal, pharyngeal, right, like our oropharynx, right, glosso is really referencing tongue, right, so hypoglossal is lower on the tongue, glossopharyngeal is tongue and the pharynx control, right? Trigeminal and facial nerves as well. Again, just helping with some of the extra facial muscles that are associated with chewing, right? But it's a very, kind of interesting, diverse use of nerves just to help us chew, right? Just to help us chew, right? So some other things about the tongue, right? Tongue is the #1 airway obstruction, right? That's just a good test question. Right? And your #1 airway obstruction is the tongue. That's why the first thing that we do is something like a head tilt chin lift or a jaw thrust. We do a simple positioning change that's designed to get that tongue out of the back of the throat. Right? So one thing we know, when that brain starts shutting off because of poor perfusion, poor oxygenation to the brain, shock, whatever it is that we want to call it, when we start going altered and that nervous system is starting to shut down, right? When the nervous system shuts down, muscles just relax, right? And so we have all these muscles that help support and stabilize the tongue. Those muscles just relax, right? And when those muscles relax, that tongue drops into the back of our throat, right? Blocks airflow, right? And the patient stops breathing, right? And so doing a head tilt chin lift, right? Immediate, rapid, simple position change, right? Can pull that jaw forward, pulls that tongue forward, and opens up that pathway to get air down to the trachea, obviously. Okay. So some other structures, right? We have, what do we have? We have the hyoid bone, right? Hyoid bone, right? It's kind of, deep up underneath your chin, right? Kind of back under there. And the hyoid bone is an interesting one. It's the one that is the only bone in the body that really doesn't directly articulate or move with any other bone, right? It's supported by, some of those, ligaments and structures to help just provide some support to the base of our tongue, right? Really don't really talk about it too much, but it's up there, right? It's way up there in your neck. Right? Other ones, we obviously have right there our epiglottis, right? Which is good. So as we're chewing up this food, we go to swallow the food, right? We have a split here. You can't really see the opening posteriorly, right? But we have the trachea opening on the front, and we have the esophagus opening behind it or posterior to the trachea. And the esophagus is obviously where we want the food to go, right? So when we're ready, when we swallow that food, right, this epiglottis drops down and covers the trachea so that the food that we eat, the only place it has to go is back down the esophagus, right? So that's when we swallow, right? That mechanical process of swallowing drops the epiglottis so that it covers the trachea, protects our respiratory tract, right? So that we don't get food, water, whatever it is going down to our lungs, right? That's called aspiration, which is why, we have such a concern for that aspiration and the need to suction if anything's in their airway. So epiglottis protects the trachea during swallowing, right? It drops down, covers it up. All right. So the next two that I brought up are digestion and secretion. They really, go so hand in hand together, right? Digestion is the chemical process of breaking down food. And in order to do that, it uses the chemicals that are being secreted by different structures. Some of those accessory digestive organs, right? So some of those are the salivary glands and the role that saliva plays, right? Stomach and all those stomach acids, liver, which produces bile, and we're going to work our way through these, and the pancreas that releases kind of pancreatic juices or pancreatic enzymes, right? And those are designed to help break down, again, those big food components and the big food molecules into the little ones, those little micronutrients that our body is going to be able to actually absorb, which will be our next step in this process. So the digestion and secretion, again, the chemical breakdown of food, right? We just took that part. The chemical breakdown of food is digestion, and then assisted by the release of water and enzymes to do it is secretion, right? So chemically breaking down the food, assisted by the release of those substances designed to help us break down that food. So salivary glands, right? We've got a couple below the tongue. I know it's kind of hard to see in that picture. We have a couple saliva glands or salivary glands below the tongue, right? And then we have a couple lower down in the jaw, right? And then we have some in the cheeks as well, right? Some in the cheeks as well. So those all produce saliva, right? And it's not just saliva as we use it, or as we call it, or spit, or anything like that. There's a particular chemical in that saliva called amylase, right? And amylase helps break down food, specifically helps break down starches, right? So if you're into the nutrition or diet world and which foods are carbohydrates and starches and proteins and fats and everything, amylase is really good at helping to break down or start that process of breaking down starches. So obviously we're physically chewing everything, right? But now some of these chemicals come into play, and those help break it down into smaller components too, right? Mucus also gets produced by some of them, and that's just going to help lubricate everything, right? It's just going to help make it a little bit easier to move through the GI system, right? Or the digestive system. So salivary glands first start in it. And then once we swallow that food, right, obviously it's going to work its way down our esophagus and into our stomach, right? And the stomach, right, as a muscle, just like everything else in this alimentary canal, right, in the system of pipes that the food's going to move through, right? The stomach is muscle, so it's got multi layers of kind of muscle tissue to help kind of contract, expand when we put a lot of food into it, and then to help kind of churn everything around to then ultimately move it into our small intestines, right? So inside the stomach, right, the big one is hydrochloric acid, right? And hydrochloric acid is really strong, right? Very, very acidic, right? Extremely low pH, right? And that's, again, just further helping to start to break down these big food components as we send it through smaller and smaller and smaller, or break it down into smaller and smaller and smaller components, right? So stomach, hydrochloric acid, right? Extremely acidic environment, right? That's why we talk about that acid reflux, right? And if some of that stomach acid is kind of working its way back up and it causes that indigestion or heartburn, right? It's that heavy acid that's in there. Right? So some structures associated with it, right? Up here at the entrance to the stomach from the esophagus, right, is we have a little sphincter up there, right, called the cardiac sphincter, right, which is really just a proximity term because right above the stomach is, right, our esophagus, or not our esophagus, yes, our diaphragm, right? Right, the stomach is right there underneath the diaphragm, and just above the diaphragm up there is the heart, right? So we're sitting slightly off to the left, right? Just slightly off to the left. So the diaphragm is right on top of the stomach, right? And that heart is just right above it, right? And the lungs and everything else up there too, right? So we have the sphincter here on the esophagus where it enters into the stomach, called the cardiac sphincter, or sometimes you'll hear them call it the lower esophageal sphincter, or the LES, lower esophageal sphincter. That one makes a little bit more sense, right? It's the sphincter lower down on the esophagus, right? As opposed to the cardiac sphincter, you say that word cardiac, everybody starts thinking heart. We're not thinking about the sphincter that's at the entrance to the stomach for food from the esophagus. Right? So cardiac sphincter or lower esophageal sphincter is the same thing that they're talking about. It's that sphincter that can close so that the food and stuff that's in our stomach doesn't come back up to the esophagus and we vomit it out. Right? So on the flip side, when we do vomit and all that stuff from the stomach comes out, is that cardiac sphincter, that lower esophageal sphincter, relaxes, opens up, and now that food from the stomach can come back into the esophagus and we can vomit it out that way. And then, like we said, right, food and everything is kind of churning around, right, inside the stomach, inside all that hydrochloric acid, as it starts to get broken down again, smaller and smaller and smaller stuff, right? And then it moves into the small intestine, and we call that food component stuff chyme, right? C-H-Y-M-E, chyme, right? So whatever is left over of that burger that we ate, right, that we chewed up, right, and the saliva came in, and then we swallowed it, and then it went into the stomach, and our stomach started breaking it down with all the acid, and now it's just kind of this, you know, food substance mass stuff, right? And that stuff moves into the small intestine, and that stuff that's moving in there, again, we call it chyme, right? And we can see here, there's another sphincter that can just help control everything, right? Remember, everything about the GI system, it wants to keep everything moving in the forward direction, right? It doesn't want stuff to move back, right? Can it? Yes, right? Obviously, we vomit or we have bowel obstructions, right? But everything is designed to try to keep everything moving forward. So we have that cardiac lower esophageal sphincter trying to keep it from moving from the stomach back up into the esophagus. And then we have another sphincter at the other end called the pyloric sphincter. And so once we have that food stuff that moves from the stomach into the small intestine, right, that pyloric sphincter closes behind it so that that food stuff, that chyme, doesn't move from the small intestine back into the stomach, right? It's trying to protect it and keep it, again, moving in the forward direction. But if remember, we obviously know it can open up. If somebody has a bowel obstruction, you know, deeper down in their intestines, right, that stuff will start working its way back up, can work its way back into the stomach, then can work its way back from the stomach back into the esophagus, they could actually, vomit up that, kind of very, significantly digested, broken down stuff that was on its way to become feces, right? And start to work its way the other direction with a bad enough bowel obstruction, right? So that's the stomach, right? And the kind of sphincters that close on either side of it. Again, just trying to help everything keep moving in that forward direction. Another thing, I wasn't really planning on getting into really disease processes today. But one of them, if we're talking about stomach ulcers, right, that's an erosion of the lining of the stomach on the inside. Right, so usually those acids and things start to break down that inner lining of the stomach, right, and it starts to erode and eat away through those layers. Right, that's what an ulcer is. It's an erosion of the lining of the stomach. Right. Good. All right. So again, really in this part, like we're talking about right now, we're in the digestion and secretion, right? So we have the hydrochloric acid that's secreted that helps to break down, digest, helps to break down chemically that food stuff, right? Other organs that come into play, right, are the liver and the pancreas, right? And the liver produces bile, right? It's one of the big functions of the liver, is it produces bile, and bile helps to break down fat, right? So it breaks down big fat molecules into smaller little fatty acids, right? So again, most of those big fats, right, we can't just absorb and use the big fat molecules. We have to break them down into the little fat molecules, right? And the little fat molecules are fatty acids, right? And bile is almost exclusively tied to the breakdown of fat, right? And so bile produces it, or the liver produces bile. And you kind of see the pipes up here, these green ones, right? Right? Those are kind of the tracks that the liver has, right, for bile to enter into the digestive system, right? So the liver makes it, right? And then we have the little offshoot over here to the gallbladder, and the gallbladder stores extra bile, right? So the liver makes the bile, the gallbladder stores it so that it's ready to go whenever it is that we need to use it, right? So bile from the liver produces, liver produces a bile. Bile breaks down big fat molecules into the little fatty acids, right? We have the macronutrients and we have the micro, right? We have to take the big stuff and break it down into the little stuff so that our body can actually use it, right? So bile does that for fat. The pancreas has its enzymes that are going to help with it as well, right? But again, like I said, we're just talking about these organs right now for their digestive system functioning components, right? The liver also produces clotting factors for the blood, right? The liver detoxifies the blood, right? The liver stores kind of backup reserves of sugar, right, in the form of glycogen, right? So those functions, right, some of those are functions on the bloodstream. Some of those are involvement with the endocrine system and being able to store sugar, right? And detoxifying the blood, making clotting factors, right? Those are other functions the liver has just outside of the digestive system. So it's helpful, I kind of go back and forth. It's helpful to study the liver and all the functions of the liver, right? That's probably a good like isolated knowledge bit, right? Like if you made a flashcard and on one side it said liver functions, and then on the back of it, it said produces bile, stores sugar in the form of glycogen, detoxifies the blood, makes clotting factors, right? That's a good flashcard for just an isolated knowledge component of what does the liver do. Okay? But when we slide over and talk about, well, what's its involvement and how does it actually work in this system, right? Then it's a little bit better to say, well, let's just talk about the system like we're doing today, the digestive system. And here's what the liver does and when it does it in the digestive system. And then later when we're learning about the bloodstream and the kind of hematologic system, right? Then we can say, okay, well, here's we have the blood and here's the organs and things that assist with the blood and keeping our bloodstream healthy and happy, right? And then we'll learn about the liver's involvement again there, right? So when I like it that way, right? I like if I'm just trying to memorize what the pancreas does, right? I'm going to have a little flashcard that says pancreas functions and all of the functions are going to be on the back of it, right? Or what's the liver do? And then on the back of that flashcard is all the things that the liver does, right? Talking about the systems though, I like just keeping it focused, right? Again, how do we eat that whale? One bite at a time, right? How are we going to learn anatomy and physiology? One bite at a time, right? We're going to learn about this just right now about the digestive system. That's how I really recommend studying these things. All right, so liver produces bile, stores it in the gallbladder, right? And it has this little tree of pathways there that we can kind of see where I've now made these red or black lines, right? And that's called, right, the biliary, right? And the root of that is bile, right? Biliary tree, biliary tract, right? Is really saying these are all those kind of channels as the liver produces the bile. These are all the channels where that bile travels to work its way either down to the intestines or to kind of divert over there to the gallbladder, right? To be stored for later. Right? Another component, right, is the pancreas. Remember, pancreas has exocrine and endocrine functions, right? So the endocrine functions is what the pancreas does in terms of producing insulin and glucagon and somatostatin to help stabilize blood sugar, right? Those are the endocrine functions because the pancreas is an endocrine gland, right? We're not talking about the endocrine system today. We're talking about the digestive system, right? So the endocrine part of the pancreas, that's all the insulin stuff that we all learn, right? On the digestive system side of it, right, that's its exocrine function, right? And the exocrine function is the enzymes that the pancreas produces, right, that help work its way over as well, right? So the bile and the bile tracts from the liver meets up with the kind of duct tube from the pancreas, right? And all the enzymes that come from the pancreas and the bile that comes from the liver and the gallbladder, and those dump into the small intestine, right? Right? And it dumps into really that first segment of the small intestine. Right? So what we're not seeing in this kind of anatomical picture is there's our diaphragm, right? And we have our stomach, right? And the esophagus. And then when that food leaves the stomach, right, it goes into the small intestine. And right there is where it meets up with the pancreas and the liver. And we get all these extra enzymes from the pancreas and the bile from the gallbladder, right? That comes really immediately into that first segment of the small intestine so that it can help further break down everything, right? So we chewed up the food, broke it down into the smaller stuff, goes into the stomach. Hydrochloric acid in the stomach helps break it down further, moves it into the small intestine. And then right there in the small intestine, bile comes from the liver, helps to break down the fat molecules, and pancreatic enzymes come in to help break down a little bit of fats, but then also, you know, some of our big carbohydrates and big proteins, right? Those all are assisted in the breakdown process by the pancreatic enzymes, right? Those exocrine enzymes, right? So fats, we said, break down to fatty acids. Carbohydrates, which are complex sugars, break down to simple sugars. Proteins break down to amino acids, right? So again, it's just taking big food components and breaking them down into those smaller, again, micronutrients, fatty acids, simple sugars, amino acids, whatever it is. And those are the things that our body is actually going to be able to absorb and utilize, right? So again, the big part with these is understanding liver produces bile. The bile gets stored in the gallbladder for when it's needed. Pancreas produces its excretion enzymes. And all of those have their role in breaking down fat. We're breaking down fats and proteins and carbs into the smaller little nutrients. And it dumps all of those chemicals, the enzymes from the pancreas and the bile, into that first segment of the small intestine, right? The very first segment of the small intestine. All right, this kind of connection point of the biliary tree, where, you know, this kind of pathway here, right, that meets up and connects with the pathway from the pancreas, is why we see those two organs really, you know, if one of them's having an issue or irritation or a problem, right, a lot of times the other one will start to develop that issue or irritation or problem. Right? So things like our chronic alcoholics who have hepatitis, right? Hepatitis, itis is inflammation, hepat references the liver, right? So liver inflammation, right, or inflammation of the liver, right? As the liver is inflamed and irritated, right, that biliary tract is going to become inflamed and irritated. And that irritation is just going to irritate the tissue next to it, and the tissue next to it, and the tissue next to it. And so that biliary tract gets irritated and irritated and irritated and irritated. And that irritation can spread, right? And now it causes irritation of the pancreas, right? Or pancreatitis, right? Inflammation, irritation of the pancreas, right? So a lot of alcoholics, where we know the alcohol is heavily dealt with by the liver, right? A lot of those chronic alcoholics that maybe are on their pathway to developing that hepatitis, a lot of them have associated pancreatitis, right? And it's not just because of that irritation spreading, it's the other things too, like having to deal with all the sugars associated with alcohol, right? But it's an easy way to think about it is those organs are actually connected, right? They have this little kind of network of pipes for the enzymes and the bile that meet up to go into the small intestine. Well, those kind of serve as a connection point between those two organs, right? So they're very kind of interrelated along that standpoint. Cool. All right. So that was all the digestion secretion, right? That chemical breakdown, right? And so now we've broken it into those fatty acids and simple sugars and amino acids. Now we need to get them into the body, right? Now we need to be able to actually absorb them so that we're able to, deliver them throughout the body. So our body can get the sugars and the nutrients and everything that it needs to stay alive and happy and healthy. Okay? So structures really heavily tied into absorption is our intestinal tract, right? So our small intestines and our large intestines, right? So the small intestines, there's three chunks, right? There's three segments of the small intestines. The very first one is the duodenum, right? And the duodenum is, again, we have, our stomach, and those are the sphincters on the stomach there. And then the stomach opens up into the small intestine. It opens up into the duodenum, that first segment of the small intestine. And that segment of the small intestine is about 10 inches long, right? So the whole thing is, 20 plus feet. All of the small intestines, if we stretched them all out, measured them, are 20 plus feet, right? More than 20 feet. That first segment of the three, there's only three of them. That first segment is 10 inches, right? And that's where the bile from the liver and the enzymes from the pancreas, right, dump in there right after that chyme, that food stuff from the stomach enters into the small intestine, right? It enters into the duodenum, and that's also where the bile and enzymes meet up from the liver and pancreas to help really kind of finalize that breakdown of big food products into those tiny little micronutrients that our body's going to actually able to absorb. So duodenum is the first little segment. The second one is the jejunum. And the third one, which is really where the small intestines connect to the large intestines, right? So duodenum, jejunum, and ileum. So the jejunum and ileum collectively are the 20 feet, right? It'll say like 18 to 23 feet or 19 to 22 feet, something like that. And roughly around about 20 feet is all the rest of it, right? And most of that's the jejunum, right? That middle one is the kind of longest segment of it. Right? And then the large intestine, we have about 5 feet of large intestines, right? And their primary function, other than having a little segment there to help break down the rest of the food, is really absorption, right? Is really the absorption of, what it says here, the organic substrates, right? That's those little fatty acids and amino acids and simple sugars, right? The broken down food components that we're able to actually use in the body. Right? Electrolytes, vitamins, water, right? That we're bringing in, right? All of those things can get absorbed, right? From the GI tract, from the intestines. And again, first place it goes is just into the interstitial space, right? Into the interstitial fluid, which is that fluid kind of between the cells. And then it starts to get absorbed from there. Right? So if you took a cross section of the small intestines, right, kind of looks like a blood vessel, right? Kind of looks like a blood vessel, right? And it really functions the same way because it is considered a smooth muscle, right? And smooth muscle, remember definitionally for the smooth muscle is it's a involuntary muscle. So it's part of the autonomic nervous system. And on the autonomic nervous system side, the digestion and absorption, the whole GI system is more heavily, dictated by the parasympathetic nervous system. Right? So when we talk sympathetic versus parasympathetic nervous system, it's the fight or flight response and the feed or breed response, right? Or rest and digest, right? That's where that one comes into play. So parasympathetic nervous system is more on this whole digestive system process, right? But it's a smooth muscle, and smooth muscle contracts and relaxes to move stuff through, right? To move contents through, right? So we have these muscular layers of the intestinal tract, the whole GI system tract, really, the whole alimentary canal, right? That was the other word that they used for it, that contracts and relaxes to keep moving that food stuff through the system, right? We said everything wants to keep moving it in that forward direction, right? So we have a word called peristalsis, right? And peristalsis is the rhythmic muscular contraction of the intestinal tract, the GI tract, to keep stuff moving forward, right? So peristalsis is kind of that rhythmic contraction of the intestines, right? The esophagus works that same way. Stomach eventually pushes stuff out, pushes it into the small intestines keep moving it forward, gets it into the large intestines keep contracting to move it forward until eventually we have that bowel movement to eliminate it, right? So peristalsis is that rhythmic muscular contraction, keeping everything moving in the forward direction, right? Ideally, right? Moving in the forward direction. So it's a smooth muscle because those muscles are contracting and relaxing to keep stuff moving through, right? And epithelium, right, is really, if you followed the skin surface, right, and we followed the skin surface into the mouth, down the esophagus, into the stomach, so the inside lining of the stomach, into the intestines, and the inside lining of the intestines, and then finally out the rectum, right? Inside lining of the rectum, and then it comes back into contact with our skin, right? That whole continuation of the skin surface, and in turn, the lining of these hollow organs, the lining of these hollow spaces, is epithelial cells or epithelial tissue, right? And that's the tissue that's going to allow the kind of mucous membranes, right? It's going to allow those to absorb those substances and to move them out of the digestive tract and again into the interstitial fluid to start the absorption process into the body from there. All right, so breaking it down a little bit. Small intestines, right? Small intestines you can simplify in your mind and say the main driving principal function of the small intestines is the nutrient absorption, right? So we said small intestines and large intestines are the two main structures of absorption, right? The small intestines are pretty much specifically those nutrients that are getting absorbed, right? So it said 90% of all of that digested stuff that's moving through our digestive tract, 90% of it gets absorbed in the lower end of the small intestines. Right? So that last little bit of segment, right? Earlier on, right, higher up in the small intestines, right? And then as they kind of keep moving down and everything, higher up in the small intestines is the bile and pancreatic enzymes that are still helping to break down food stuff into those smaller micronutrients, right? Once we get down to the lower end of the small intestines, that's where the magic is happening, right? That's where we're getting that nutrient absorption, where it moves across kind of the membrane wall there of the intestinal tract, and then into that interstitial space, into the interstitial fluid that we can actually then kind of absorb and utilize from there, right? So small intestines are very much nutrient absorption, right? That's kind of the simplified way that you can put it. Good. What we're not showing in any of these pictures is, you know, remember every structure inside the body needs blood flow to stay alive, right? Every cell, every muscle needs blood flow to stay alive. So the intestinal tract's no different. It needs blood flow to stay alive. And so what we have is there's, you know, membranes that are, you know, kind of holding up and stabilizing all of these intestines, right? They're not free-floating structures, because if they were, they would all just sink to the bottom of our abdominal cavity and pelvic cavity by gravity, right? So something's kind of holding them up, right? And that membrane that's holding them up, right? The small intestines, the large intestines, is called the mesentery, right? And the mesentery is where all the vasculature is, right? That's actually perfusing, right? It's where all the blood vessels are that's actually perfusing the intestinal tract, right? So it's holding up and stabilizing the intestines in the abdomen so that they all don't just kind of sink to the bottom of our abdominal cavity, right? So they hold them up, and that's where the blood vessels are to perfuse the tissues, right? Is the mesentery. Now, historically, they'd always talked about it just as kind of this membrane layer. But it was a couple of years ago I saw, it was some science article that was saying they're actually now calling the mesentery an organ on its own, right? Because it fits the definition of an organ, which is, you know, multiple tissues that all function together and, you know, have a principal driving function, right? And so mesentery, it used to just be, oh yeah, that's the membrane that holds it up and helps to perfuse the organs, right? In the abdomen, at the intestines and everything. And now they're saying that, well, that actually fits the criteria of being called an organ on its own, right? So it was a couple of years ago, the article was, we have a new organ, right? And it's like, dude, we've been studying anatomy and physiology for a long time. How did we find a new organ? It was really just a terminology thing. They took this mesentery and said, hey, now it fits the criteria of being called an organ. So we're going to call it an organ. So now we have a new organ. Right? kind of like on planets, right? Pluto used to be a planet, and they said, well, doesn't actually fit the definition anymore of a planet, so we lost a planet, right? We didn't lose a planet from the galaxy, right? From the solar system. It just didn't fit the definition criteria that we use for it. Right? Anyways, side note there. So small intestines, nutrient absorption. Large intestines, water absorption, right? Large intestines, much more so, right? All the nutrients for the most part have been absorbed. Some may still be there, right? But the large intestines, maybe they can pull out some nutrients, but it's really water, right? So make it simple in your head. Small intestines, nutrient absorption. Large intestines, water absorption. Does some water get reabsorbed in the small intestines? Yes. Does some nutrients get absorbed in the large intestines? Yes. But the vast majority of nutrient absorption is small intestines, and the vast majority of the water reabsorption is the large intestines. Right? So we've kind of peeled out everything else, right? So we have all those small intestines that are working their way through, and the small intestines enter into or connect with the large intestines in our right lower quadrant here, right? The right lower quadrant here. And that's where we have our appendix, right? Is that little tail that dangles off from the large intestine there, right? And so food enters the large intestine, right lower quadrant, works its way up, works its way across, and works its way down our other side, and eventually it has to kind of curve to go back centrally for any of that fecal matter now at that point to exit out to become a bowel movement. Right? So starts in the right lower quadrant, works its way up, over, down the other side, and then midline for elimination coming in a second. All right, so we have large intestines, right? More commonly called colon. Right? So we have the ascending colon, right? Ascending, it's going up. We have the transverse colon, right? Trans is going across. You can probably anticipate what this one's going to be is the descending colon as it goes down. And then the kind of curvature back to the middle is called the sigmoid colon, right? Sigmoid colon. Okay. And again, the large intestine is really water reabsorption. It's saying we've pretty much got everything out of this food that we're going to get out of it. Now let's also just retain any extra water, right? Because if we didn't, it would be diarrhea all the time, right? Just very liquefied, right? So we have to reabsorb the water so that we're not constantly becoming dehydrated just by having bowel movements and releasing that extra water. Let's reabsorb whatever it is that we need. And then that food product stuff that's left over that didn't get digested, didn't get utilized, that leftover stuff and the waste products that are there now become feces or stool that then we're obviously going to eliminate from the body. Right? Okay, good. Right, and that's what you see, right, if you get a colonoscopy, right? So the excretion part is, again, just that last segment of that large intestines, the colon, and then the rectum, and then obviously the anus, the exterior, right? So the remaining products of digestion become feces. We've reabsorbed everything that we're going to reabsorb, right? We reabsorbed all the water. Our body has kind of pulled the nutrients that it wants to pull out of it. And then still by that peristalsis muscle contraction is still just moving everything through until ultimately we have that bowel movement and we eliminate it from the body, right? So just like in shock and the respiratory system and everything, right? It's a two-sided coin, right? We got to get the good stuff in and then we got to get the bad stuff out, right? So we eat food to get the good stuff, the nutrients into the body, and then the waste products, right? We got to eliminate, right? If we just put more food in all the time, but we never eliminated, it would start to cause problems, right? we would have all that fecal matter and everything just staying inside the system, right? So yes, it's important to get the good stuff in, but it's just as important to get the waste products out, because otherwise it builds up, becomes a toxic environment for us, right? So you got to get the good stuff in, and we got to get the bad stuff out. So that's the end of it, right? So it's really the two very ends of it is the ingestion part, right? Eating the food, and then the excretion part, eliminating the leftover, right? And then that inner part of the digestion, the secretion, and the absorption and everything is the use, right? Getting that stuff in, right? Getting the nutrients into the body. All right. And so big picture, right? Again, just as like a kind of quicker recap, right? Is we swallow food, right? If we just kind of walked our way through the whole pathway, right? We swallow food, and food goes down our esophagus, which you can't see here in this picture. It goes down the esophagus, which is posterior or behind the trachea, right? Goes down the esophagus, right? Behind the heart and lungs and everything, and enters into our stomach, right? And that was the saliva and the mucus that helped to break down that food in our mouth, right? And then the mucus to lubricate it, to make it easier to move down our esophagus into the stomach. And that's where it gets churned around in the stomach with all that hydrochloric acid, right? To really help keep breaking down that food stuff. And then it moves from the stomach through those sphincters into the small intestine. And that's where the bile from the liver and the gallbladder and the enzymes from the pancreas all meet up, right? And dump those enzymes right there into that first segment of the small intestine called the duodenum. And that's where the bile breaks down big fats into the little fatty acids, and the pancreatic enzymes also help break down the fat, but break down the big carbohydrates, those complex sugars, into simple sugars, and the big protein molecules into the little amino acids, right? Getting everything down to that micronutrient level, right? That happens in the small intestines, right? And that first segment of the small intestines we said was the duodenum, about 10 inches long, right? And that's really the final breakdown component of those food particles. And then the lower end, the rest of that small intestine, the jejunum and the ileum, are all about the nutrient absorption, right? All about the nutrient absorption. And then that connects to the large intestine in the right lower quadrant. And that digested food component stuff works its way up and around the large intestine, where really the thing happening now is just water reabsorption, right? Is to keep all that water inside our body so that we're not becoming dehydrated because of having bowel movements, right? And it works its way across midline until we eliminate in a bowel movement, right? That's kind of that start to finish, right? And remember all that kind of pipe of esophagus to stomach to small intestine to large intestine, that was called the alimentary canal. And then we have the accessory digestive organs, the liver, the stomach, the pancreas, that are secreting those enzymes to assist with that digestive chemical breakdown process. Right? So that's the whole kind of start to finish piece of the digestive tract, right? And everything that kind of works its way through then. Then the last little point that I wanted to hit is going back to our 4-quadrant system. Right? So we have right upper quadrant, right lower quadrant, left upper quadrant, and left lower quadrant. Right? It's such a good exercise to be able to just close your eyes and picture the 4 quadrants, and to be able to picture which organs and structures fall within which of those quadrants. Because if somebody's complaining of right upper quadrant abdominal pain, and we know that really the only things up there in that right upper quadrant is our liver and gallbladder, right? we can see, okay, yeah, a little bit of some of the intestines kind of, fall into that quadrant, but really just those two. Then if somebody's complaining of right upper quadrant abdominal pain, there's a high degree of likelihood that it's probably one of those two structures. Or lower abdominal pain, well, really the only thing kind of down there are the intestines, right? And we can add in the reproductive system and some other stuff too, for sure, right? But at its kind of starting point of having a good idea of what structures are falling in which quadrant can really help on the patient assessment side, where you can start to look at it as, okay, your patient's complaining of right upper quadrant pain, and boom, you're like, all right, liver, gallbladder. And then read the rest of the question and see, does it fit with, one of those two structures? It probably will. Okay. So that's kind of the classic 4-quadrant, right, where it splits at the belly button, right? The umbilicus is where the kind of split for the quadrants are. There's the 9-quadrant, not quadrant, there's the 9-area split, where you have like the epigastric and suprapubic and iliac and the hypochondriac areas. And it's there, maybe a testable knowledge component, but everybody pretty much, all of us, paramedicine, EMTs, everybody, we're really landing on just this simple 4-quadrant system as a starting point. And remember, if somebody is having, right lower quadrant abdominal pain, on the physical exam side of it, right, remember, we're going to palpate the area that hurts the most. We're going to palpate it last, right? So if the right lower quadrant is hurting, we're going to start opposite. So we'll start left upper quadrant, palpate, see how we do, and then palpate the other areas. And then lastly, we will go down and palpate the area that's hurting. Right? Because if the right lower quadrant's hurting and you push on that and it causes a lot of pain or discomfort, now everything hurts, and everywhere else hurts when we palpate there, right? So we want to palpate the area that's hurting the most. We want to palpate it last, and we're going to start with the opposite area, right? So right lower quadrant, we'll start with the left upper quadrant, right? Now, other things, right, when we look at it, right lower quadrant abdominal pain is the big kind of common presentation for that appendicitis, right? Because that's where the appendix is, in that right lower quadrant, right? Now you can have associated left lower quadrant abdominal pain, because of that appendicitis for sure, but kind of classically and simplistically, that's where the appendix is. So if it's inflamed and irritated, that's where the pain's going to be, in that right lower quadrant, right? Right upper quadrant, they're big on hepatitis and an inflamed gallbladder, cholecystitis, right? Is the right upper quadrant, because that's where the liver is and the gallbladder there behind it, right? Yeah. Left lower quadrant, right? Left lower quadrant is a big one with diverticulitis, right? If you we're trying to figure out, what are some common complaints in those particular areas. Left lower quadrant abdominal pain is diverticulitis, right? Or that's where that pain complaint is likely going to show up, right? It's in that kind of sharp curve over of the large intestine is where those diverticuli little pockets show up that feces and food products get stuck in. And then it causes that inflammation, irritation, and can progress towards infection and sepsis and everything, right? So diverticulitis is that left lower quadrant, right? Now, obviously, again, then when we add in the reproductive system, right, especially on the females, and we have the ovaries and the fallopian tubes, right? Those are right lower quadrant and left lower quadrant structures, right? So we have to, reserve that possibility that, hey, maybe it's a ectopic pregnancy for a female of childbearing age, right? And they're having left lower quadrant pain, and it's not diverticulitis. Maybe it's a ovary torsion, where that ovary twisted, or an ectopic pregnancy where that fertilized egg cell is starting to grow because it got stuck and lodged into the wall of the fallopian tube, right? So we have some classic ones like appendicitis on right lower quadrant and diverticulitis on left lower quadrant, but there's other stuff too, right? So we're not just going to jump on like a test question or something. We're not just going to jump immediately when we read a scenario that says right lower quadrant abdominal pain, and our brain just shuts off because all we see now is appendicitis, right? Well, that's just one option on the list of our differential diagnosis, or our field impression or working diagnosis, right? That idea that we have of what we think is going on with our patient, right? We start with a long list of things, right? Like if I said, okay, we have right lower quadrant of abdominal pain. All right, immediately on the list, right? Appendicitis, right? On the list, if it's a female, it can be ovary torsion. It could be ectopic pregnancy, right? It could be pelvic inflammatory disease or some other infection. It could be they have just a GI bug, right? Gastroenteritis, and it's just the intestines are uncomfortable there. That could show up in the right lower quadrant, right? And so we have this list of all of these different things that we think it could be just based off of one bit of information, which is a complaint of right lower quadrant abdominal pain. And then what happens is we get a history, and we get a set of vitals, and we get a physical exam, right? And in that process of collecting more information, we're able to make better distinctions and more intelligent decisions and say, okay, my patient's 80 years old. So I'm going to go ahead and say ectopic pregnancy is probably not on the list of likely differential diagnosis. So let's kind of cross that one out as unlikely, right? No other signs of an infection or anything like that. So maybe we cross out the infection one as a possibility. We don't have, kind of the classic presentation that we would normally expect to with appendicitis, and 80 years old is kind of old for appendicitis. So maybe I'm not thinking that one. Maybe I'm thinking, they just have a little GI bug, right? And they're uncomfortable, or something else may be going on, right? So that's how we work on it, right? As we get more information, we start ruling stuff out. We start saying, okay, this doesn't fit that kind of classic presentation picture that I have in my head. This doesn't really fit. This doesn't really fit. Okay, this is starting to look realistic. All right, getting more information. All right, yeah, it really feels like this is probably what's going on with our patient, right? Sometimes it's more difficult when we have those abdominal pain complaint patients, because there's so many different organs and structures and tissues in there that can be the issue, that it's hard to identify a lot of them kind of, separately from some of the other ones, right? So we got to look at which ones do have some kind of very classic presentations, and let's work on remembering those classic presentations. And then if nothing is fitting into any of those, then we just kind of start stepping back and saying, you know what, we really are having a hard time kind of figuring out what's going on with them. And that's when they'll go to the hospital, and maybe they get that CT of the abdomen, that CAT scan of the abdomen, to take a look at, what are all those structures actually looking like? And they'll see, oh, look, there's a bowel obstruction. That was what's actually causing their problem. Or, there's a colon cancer, right? There was a tumor in their colon. That's what was actually causing their complaint, right? So some of the things that we can recognize based on some of those classic presentations, and other things really difficult for us to identify with kind of that, limited time frame and limited tools in which we can actually assess, an abdominal pain complaint, patient, right? But for starters, right, have a real clear idea of which organs fall in which quadrant, and that will go a long way to helping you identify that differential diagnosis for them. Right? Because remember, that's the bulk majority of our questions, is here's a bunch of information. What's your differential diagnosis? What do you think's going on with your patient? Or here's a bunch of information. What are you going to do about it? How are you going to treat them? And most of the abdominal complaint patients will treat the nausea, right? On the paramedic side, we'll treat the nausea, Zofran maybe. Pain meds maybe, although that one's a heavily protocol dependent, whether you can use the pain meds for abdominal pain. Some places you can, some places you can't. And then, fluid boluses, if they're dehydrated, or certainly if there's any sort of sign of sepsis, obviously we're going to get much more aggressive on fluid, right? but really a much smaller list, right? If there's something kind of, critically going on with some component of their abdominal cavity or digestive tract or something, oftentimes they're going to need surgery, right? So we're really, symptom management, treating the pain if we're allowed to, treating the nausea if they're nauseous or vomiting, right? Treating the dehydration if we're seeing those signs and symptoms, right? So we're more on symptom management as opposed to kind of really directly trying to treat, the disease process or whatever it is that they have that's going on, right? And those are all the different structures, and that's really the starting point for all of this, right? Is working our way through just an understanding of what organs are involved in digestion, where do they have an effect on in this whole process, and what is the principal function of all these different structures on this whole digestive system process, going back to those 6 main processes of ingestion, mechanical processing, and then the digestion, secretion, absorption, and then ultimately the excretion or elimination from the digestive tract. All right, so thank you very much. Hopefully this was a helpful little review of the digestive system, and we'll keep doing more. But really, I just know, just from the last 10 years of experience with EMT and paramedic students, is anatomy and physiology is a big stressor for a lot of people because they're not always coming in with all of this anatomy and physiology background or understanding. I know when I took EMT school, I had never done an anatomy and physiology class. It was all new to me. Right? Nobody in my family was healthcare. Nobody was, in the fire service or doctors or nurses, nothing, right? So it was brand new to me when I was in EMT school. And then I went to paramedic school, and the only anatomy and physiology I had coming into paramedic school was the stuff that I learned in EMT school, right? So then it was just kind of keep pushing at it and keep, just opening up this whole world of anatomy and physiology understanding, right? It stresses a lot of people out because they look at that chapter in the textbook and it's everything, right? The anatomy and physiology chapter in the textbook can be on its own like 2 college semesters of anatomy and physiology, right? Everything is in there, right? And oftentimes very deep, right? All the way down to, cellular anatomy and physiology and the electron transport chain and all those different things, right? But we have to start with something, right? Because we can't get just lost looking at the whole picture. We have to start somewhere. So the textbooks, I've always kind of disagreed with the layout. They always start with cellular anatomy and physiology and then work their way up to like the big organs and structures that we're comfortable with. I personally think you should start with the big organs and structures that understand those functions and then how they work and how that works, and then work your way deeper down into anatomy and physiology, right? So, because if you don't understand, how the heart works in pumping blood, it probably doesn't make a whole lot of sense to start with cellular metabolism, right? Dude doesn't know what the heart does. We should not be talking about cellular metabolism. Let's start with the big systems and say, what's the heart do? What's the liver do? What's the lungs do? And then how does the cardiovascular system work with the heart and the lungs and the bloodstream? And how does the digestive system work with the esophagus, the stomach, the small and large intestines? And then once you get comfortable with that level of anatomy and physiology, then go down to the next level and say, well, what are those electrolytes doing? Or how does this absorption process really happen? Ultimately, how does these cells actually stay alive? Because the cells can keep making energy, and that energy is ATP coming from the mitochondria, and here's how it does its job, right? It's get comfortable with the top layer, what the organs are and what they do, and then put those organs into a big body system like cardiovascular or respiratory or GI. Once you're comfortable with that, get down to the smaller structures within those organs, and then work your way down. Once you're comfortable each step of the way, you can work your way down to finally, cellular level if you need to get down that far for the understanding, right? But starting down there with stuff that we can't really visualize super well, and most of us don't have a strong background in, I think causes more harm to trying to learn this anatomy and physiology than helping in the first place. Right? So I encourage you to start with the big organs and big structures, and then as you're comfortable with it, dive deeper and deeper and deeper down into anatomy and physiology. Right? But again, thank you. Hopefully this was a good review, and we will do more videos and more sessions on different body systems as we just keep working our way through anatomy and physiology. Thank you.